Hello, my name is Kory Baker, and this is my mammal heart dissection for Miss Segraves A&P 1. The first thing that I did with this dissection is I cut the heart into two and marked a few structures. This first one right here I've marked is the aorta, and the aorta is an artery that carries oxygenated blood from the left ventricle. Next I marked is the aortic valve, and this valve opens to allow blood to enter the aorta from the left ventricle and closes to prevent backflow. This next one that I have marked is the atrial appendage, and the atrial appendage projection from the main chamber of each atrium. It forms an ear-like flap over a portion of the atrium. Next I've marked is the bicuspid valve, and the bicuspid valve is a valve between the left atrium and left ventricle. It opens during flow from the atrium into the ventricle and closes during ventricular contractions, also known as the mitral valve or as a left atrioventricular valve. Next I've marked is the chordae tendineae, and that is a fibrous cord connecting the atrioventricular valves to the papillary muscles in the ventricles. They help hold the valve closed during the force of the ventricular contractions. This next one is the intraventricular septum. This is the muscular wall between the left and right ventricle. Okay, now that I have marked some other structures, this structure right here is the left atrium, and it is a chamber that receives oxygenated blood from the lungs through the pulmonary vein. Next, this one right here is the left ventricle, and it is a thick-walled chamber that pumps freshly oxygenated blood through the aorta. And then right here, you have the tricuspid valve, and it is a valve between the right atrium and the right ventricles. It opens during flow from the atrium into the ventricles and closes during ventricular contractions. It is also known as the right atrioventricular valve. Next, I don't have it marked, but these bands of fiber, they're muscle fibers, is the trabeculae carneae. Probably didn't say that right, but it is a band of muscle fibers protruding from the walls of the ventriculars. Okay, and now I have marked these structures on the other side of the heart. This first one is the pulmonary trunk, and is a large artery that exits the right ventricle and immediately splits into left and right pulmonary artery, each carrying deoxygenated blood to a lung. Move this a little closer. Next is the papillary muscles, which are down here. It is the muscles on the inner wall of each ventricle. They attach to the chordae tendineae and contract to tighten the chordae and hold the atrioventricular valve tightly shut when the ventricle contracts. And then this one right here, it is the right atrium. It's the chamber that receives deoxygenated blood from the body through two venae cavae. Now this completes my mammal heart. Thank you.